Welcome to the deep dive.
Mm.
I'm really glad you're joining us today because we are unpacking a piece of source material that genuinely feels like, I don't know, like looking into the future of healthcare.
Right, but by looking thousands of years into the past.
Exactly. We got our hands on this fascinating and frankly mind-bending transcript from a March 2026 meeting.
It is a really unique document.
It really is.
Wow.
On one side of this virtual table, you have nursing educators from Salem University in the U.S., along with an Atlanta-based integrative cardiologist.
Mhm.
And on the other side, traditional medical practitioners from the Health India Foundation, logging in all the way from Chennai, India.
So our mission for this deep dive is to explore what happens when a modern medical system just hits an absolute breaking point.
Yeah,
We're going to look at how the severe health crisis currently playing out in rural America is driving this highly unexpected collaboration with an ancient, thousands of years old Indian medical system.
it's wild.
It really challenges everything we assume about how healthcare is supposed to evolve, you know?
It is such an incredible contrast to read through.
Mm-hmm.
I mean, in one breath, these professionals are discussing high-tech, modern telehealth, AI, remote patient monitoring.
Yep.
And then, without skipping a beat, they are just deep in the weeds discussing ancient therapies like energy point stimulation, traditional pulse reading, and yes, we are absolutely going to get into leech therapy today.
I know we would. You can't ignore the leeches.
You really can. So let's start at the beginning. If you are sitting in a U.S. nursing school right now, why are you actively seeking out traditional practitioners from Chennai? What is the actual catalyst here?
Well, the catalyst is the sheer scale of the rural health crisis, and the
Yeah.
transcript highlights this specifically through the lens of West Virginia.
Right.
The Atlanta-based cardiologist in this meeting mentions that he actually spent a year working in West Virginia, and the picture he paints is, well, it's grim.
Very grim.
He notes that the state essentially carries the worst disease burden in the entire country. We're looking at rampant, totally unmanaged high blood pressure, massive rates of heart attacks, and systemic diabetes. He describes it as being startlingly commonplace to see people suffering from these severe cascading conditions day in and day out.
So think about what that actually looks like on the ground for a second.
Yeah.
If you live in one of these rural areas, you might be driving 2 hours just to see a specialist.
Easily 2 hours.
Right.
Yeah.
And what this transcript really puts a spotlight on is the absolute limit of the standard medical model we all rely on.
That is the core issue right there. The standard healthcare system that you and I interact with is overwhelmingly reactive.
It waits for you to break.
Exactly. It waits for you to get visibly sick, and then it attempts to manage or suppress those symptoms. But in rural areas where you have that limited access to specialists and where the cultural relationship with food and health might be very different, this reactive model just hits a massive wall.
We can't keep up.
No, the sheer volume of chronic disease is outpacing the system's ability to manage it with a traditional, pill for every ill approach.
Yeah. To really ground this, there is this striking anecdote in the transcript from Dr. Nikita Nelson. She is one of the nursing educators at Salem University.
Such a powerful story.
It really is. She shares this deeply personal, incredibly frustrating story about her own family. She comes from a military background. These are highly active people.
Right, not sedentary at all.
Exactly.
Mm.
She and her brother are retired military, which means their baseline involves running, jumping, hauling heavy gear. They were the furthest thing from couch potatoes.
Yeah.
Yet she shares that she and every single one of her siblings were placed on blood pressure medications by the age of 35.
And that detail is what makes her story so vital to this conversation.
Regardless of their weight, regardless of their intense activity levels, the medical response was just, boom, here is your daily hypertensive medicine for the rest of your life.
It forces medical professionals to take a hard look in the mirror. When even highly active, relatively young individuals are being funneled straight into chronic lifelong medication, it begs the question, what fundamental biological signals are we ignoring?
It makes me think of having a car where the check engine light keeps flashing on the dashboard.
Oh, that's a good way to look at it.
You take it to the mechanic, and instead of opening the hood to find out why the engine is misfiring, the mechanic just hands you a piece of black tape to stick over the light.
Just cover it up.
Yeah. You drive away, the annoying light is gone, but the engine is still quietly destroying itself underneath. In this scenario, the blood pressure medication is the black tape.
That analogy hits the nail on the head. And it's that exact realization driving a massive shift toward what the speakers in the meeting call a cardiometabolic and integrative approach.
Cardiometabolic.
Right. For a long time, Western medicine treated the body's plumbing, the cardio and the body's fuel processing, the metabolic system, as if they were in two completely different garages worked on by different mechanics.
Interesting.
But now there is a growing consensus that we have to look at the whole car. We have to address holistic, population-level health, the environment, and how these systems actually interact.
And the cardiologist in the meeting points out that this integrative approach isn't just a fringe idea anymore. It is gaining serious mainstream momentum across the country.
He does point that out. And to illustrate how mainstream this is getting, the discussion briefly notes a recent movement referred to as MHA, or Make America Healthy Again, pointing to its focus on these integrative approaches.
Right.
And I want to be crystal clear with you as we discuss this. Our goal today isn't to endorse any political movements or take any sides whatsoever. We are simply imparting the details as they were discussed in the source material.
Just reporting the facts from the transcript.
Exactly. But what that observation represents is fascinating. It shows that the public demand for a more holistic root cause approach to chronic disease is bubbling up into broader national conversations, completely transcending the usual medical silos.
So we have this burning need for a new toolkit. The black tape isn't working anymore. What is the solution they actually propose in this meeting? Because this is where the transcript takes a wild turn.
The proposed solution is a highly structured system called Siddha medicine.
Walk me through what that actually is, because I think most of us listening have maybe heard of Ayurveda or traditional Chinese medicine, but Siddha is definitely not a household name in the U.S.
Siddha is a distinct, ancient, traditional medical system originating from Tamil Nadu in southern India. It shares some philosophical DNA with Ayurveda, but it has its own unique texts, modalities, and pharmacological approaches.
Okay.
And it is rapidly gaining its own independent global recognition right now.
Okay, but if I am a skeptic, and I am putting myself in the shoes of someone used to Western empirical science here, how do we know this isn't just wellness influencer stuff? Why is an Atlanta cardiologist and a U.S. nursing school taking this so seriously?
The credibility brought to this specific meeting is massive. The practitioners on the other side of the call represent the Health India Foundation in Chennai. This organization was actually founded by a modern medical professor who served as a consultant for the World Health Organization. They aren't rejecting Western medicine. They are running an integrative hospital that has been open since 2002.
Oh, wow.
And they have meticulously treated over 38,000 patients by explicitly combining conventional modern medicine with traditional Siddha treatments.
38,000 patients is a serious sample size.
Exactly. It moves the conversation out of the realm of theory and into the realm of hard clinical outcomes, showing how these two dramatically different systems can actually complement each other.
Let's get into the actual treatments, because reading this section of the transcript was just one aha moment after another for me.
It's fascinating.
How are they physically treating these cardiometabolic issues? Let's start with Varman therapy. What is that?
Varman therapy is essentially an energy point stimulation technique. According to the ancient Tamil texts, the human body has over 100 specific vital energy points. A trained practitioner identifies these points and stimulates them manually to unblock or reroute energy. If you are familiar with acupuncture and traditional Chinese medicine, it is conceptually similar, though Siddha uses physical pressure rather than needles.
Interesting.
And they aren't just using this for relaxation, they're actively applying it to complex musculoskeletal disorders and even psychiatric issues.
Okay, so Varman handles the nervous system and the energy routing. But what about the physical building blocks of the body? The transcript talks extensively about Siddha culinary medicine, which sounds amazing, but how is that different from a standard Western nutritionist telling you to just eat more broccoli?
The difference lies in the precision. Siddha culinary medicine doesn't just offer broad dietary guidelines. It uses specific traditional Tamil foods combined in highly specific homemade preparations, dosed almost like a pharmaceutical.
Dose like medicine.
Yes. They use this targeted culinary approach alongside conventional therapies to actively attempt to reverse cardiometabolic disorders. Food is elevated from basic fuel to a highly prescribed medical intervention.
That makes so much sense when you think about the rural health crisis we started with. If the food environment is causing the disease, the food itself has to be part of the actual cure, not just an afterthought.
Exactly.
And speaking of diagnostics, how are they figuring out what's wrong with a patient before they prescribe these foods? The transcript mentions traditional pulse reading.
This is a cornerstone of their diagnostic process. In the Siddha system, practitioners are trained to diagnose the state of a patient's three life force energies simply by examining the pulse wave on the wrist.
Just from the wrist.
Just the wrist. It requires years of immense skill to master, but it offers a completely non-invasive way to read the fundamental physiological and metabolic state of the patient long before a disease might manifest in a standard blood test.
Okay, I have held off as long as I can. You have to walk me through the leeches.
Here we go.
Because, honestly, to an American listener, reading that a modern medical cohort is discussing leech therapy sounds like we are teleporting back to the Middle Ages. How is an Atlanta cardiologist getting behind leeches?
It sounds incredibly jarring at first, I totally agree, but they discuss it as an external therapy that they actively teach. And the kicker that might surprise you, leech therapy is actually FDA approved in the United States.
Wait, really? FDA approved?
Yes. Modern regulatory bodies have had to recognize it because in specific clinical scenarios like modern reconstructive microsurgery or severe venous congestion, the specific anticoagulants in leech saliva work better than almost anything else we have.
That is wild.
It's an ancient practice that empirical science eventually had to validate.
That completely flips the script. We assume ancient means primitive, but sometimes it's just a different kind of advanced technology.
That's a great way to put it.
And they also mentioned Siddha yoga therapy, which I assume is much more specific than just going to your local studio to stretch.
Much more specific. They prescribe highly targeted yoga regimens specifically for managing anxiety and hypertension. And if you look at the broader implications of all these modalities, they're being actively studied and applied to incredibly challenging conditions.
The transcript mentions they're treating serious autoimmune disorders, right?
Yes, incredibly difficult, painful conditions to manage, like psoriasis and rheumatoid arthritis.
Yeah.
But perhaps the most surprising detail in the source material is the mention of the Swabiman Institute in Chennai. They are actively studying and teaching how to manage autism spectrum disorders using Siddha medicine.
Autism.
Yes, specifically utilizing that Varmum energy stimulation we talked about alongside other integrative therapies.
So let's take a step back and look at the logistics of all this. We have this massive reactive health crisis in the U.S. And we have this highly developed, ancient, integrative system in India with a proven track record.
Right.
The obvious hurdle is bridging the gap. How do you actually get a medical student in Atlanta to learn and apply an ancient Tamil practice?
Well, the transcript doesn't just theorize about this, it provides a literal blueprint for how these worlds are merging right now. There are already formal memorandums of understanding MOUs in place between the Manipal Academy of Higher Education in India and the Morehouse School of Medicine in Atlanta.
The Morehouse connection feels huge because it means the pipeline already exists. The transcript outlines these amazing 4-week medical electives where fourth-year U.S. medical students pack their bags and actually travel to Chennai.
And it is a total ground-up immersion. These students aren't just sitting in a sterile lecture hall looking at slides.
Right.
They participate in a 5K Siddha walkathon. They go out into the field, set up free medical camps, and actually provide treatment in underprivileged areas.
That is so hands-on.
Extremely. They visit medicinal plant gardens so they can physically understand the raw materials of the therapies they are prescribing, and they learn how these traditional medicines are meticulously manufactured.
They even participate in traditional Tamil cultural festivals. The experts in the meeting make a fantastic point here. Understanding the culture is primordial to understanding the medical system itself.
Absolutely.
You cannot separate the lifestyle of the people from the treatment of the people. And for those students who simply can't afford or manage the travel to India, they've built an 8-week online course covering the basics of the Siddha system and non-invasive diagnostics.
Which brings us directly back to the Salem University educators sitting in on this meeting. Why are they at this table? Why is a U.S. nursing program in particular so eager to adopt this ancient framework?
The cardiologist asks them that exact question. He asks about their job placement and what they're looking for in the coming year. And the educators realize that the entire future of rural health rests squarely on the shoulders of nurses.
This is a profoundly important point about the future of healthcare labor that we all need to pay attention to. The cardiologist notes that artificial intelligence is already coming in and taking over a massive amount of routine medical tasks.
Like charting and data entry.
Exactly. Charting, basic triage, data entry. Combine that AI integration with a massive push toward telehealth, remote patient monitoring, and reimbursable population health models, and the day-to-day role of the nurse is fundamentally transforming.
They can't just be the people dispensing pills and checking boxes anymore. AI can check the boxes.
Precisely. The next generation of nurses, especially those coming out of Bachelor of Science in nursing programs, need to be trained as health coaches.
Health coaches, I love that.
They need to be holistic, integrative guides. Think about it. They are the ones who are going to be sitting in their communities, perhaps in remote parts of West Virginia, managing chronic care for dozens of patients remotely.
Right.
They need a much wider array of tools to actually help patients improve their daily lifestyles rather than just adjusting a medication dosage over a Zoom call.
So Salem University is looking at this Siddha framework and saying, we desperately need this in our curriculum. They want to create formal electives where nursing students can use their financial aid to study these integrative practices. And the logistics of how they plan to fund this is just brilliant.
It always comes down to funding. They discuss applying for NIH National Institutes of Health Rural Transformation grants.
Okay.
Their vision is to use federal grant money to fund scholarships, effectively paying nursing students to learn these new ancient disciplines. The goal is to boost nursing enrollment by offering something totally unique, while simultaneously bringing a fresh, preventative approach to a state that desperately needs it.
Let's just pause and appreciate the sheer agility of that idea. They're essentially saying, let's use federal rural health grants to formally train West Virginia nurses in ancient Indian energy therapies and culinary medicine, because the standard Western way is failing our people.
It's a bold move.
It really is. And they aren't dragging their feet. They talk about drafting an MOU immediately. They even invite the Salem nursing team to an upcoming 2-day retreat in Dallas on April 12th and 13th to showcase the foundation of this practice in person.
It shows an incredible level of open-mindedness from the academic institution. They are actively seeking to build a collaborative partnership because they recognize a fundamental truth. You need someone deeply well-versed in modern medicine to properly translate and safely integrate traditional medicine.
Right.
You simply cannot operate in protective silos anymore when the disease burden is this high.
So let's zoom out and look at the big picture of what we've uncovered today. The ultimate takeaway from this deep dive is a stunning paradox. The solution to the high-tech, deeply entrenched healthcare crisis in rural America might not be a shiny new pill.
No.
It might just be a seamless fusion of AI-driven telehealth delivery systems and 3,000-year-old culinary and energy practices. It is the ultimate blending of the oldest human wisdom with the newest technological delivery.
It is a remarkable synthesis. And as we wrap up, I want you to reflect on your own approach. Think about your own philosophy when it comes to your health and the health of your family. Are you strictly relying on that modern fix-it-when-it-breaks model?
The black tape.
Exactly. Are you just waiting for your biological check engine light to come on, hoping there's a pill to turn it off? Or are there daily preventative traditions, whether that involves culinary medicine, movement, or mindfulness, that you could be integrating into your life right now?
That is the real question we all need to be asking ourselves. It completely flips the script on what it means to actually take care of yourself.
It does, and I want to leave you with one final provocative thought to mull over long after this discussion ends. If a major U.S. nursing school is writing federal grants to formally integrate ancient pulse reading, medicinal foods, and energy point stimulation into mainstream Western healthcare, what other forgotten historical knowledge might we be overlooking? What other ancient systems, currently dismissed as myth or mere tradition, could actually hold the keys to solving our most pressing modern crises?
Wow, that is definitely something to sit with. It makes you realize that sometimes the most innovative, cutting-edge step forward is actually a giant leap backward into our shared history. Thank you so much for joining us on this deep dive. We hope it sparked some new ideas for you, and we will catch you next time.